Everyone, welcome to Ndanda's World. This is Gracious here at Graciousmoyo on Facebook, at gracious_aya on Instagram. If you're a returning subscriber, thank you so much for tuning in once again. If you are a new body on this platform, you are highly welcome. Consider subscribing to this video so that you continue to get much more output of the content. Guys, don't forget to like this video, don't forget to comment so that I know what you want to know, or I know what you're supposed to get per request. Okay, so you guys, without much further ado, let's get let's dive in right now into the theme of this video. So today it's step-by-step detailed way of you wanting to get your diploma or your certificate recognized in Germany as a nurse. So for example, I was already a qualified nurse in Zimbabwe, but my aim was to get a German recognition so that I can work as a German nurse at the end of the day. So you may be wondering, what are the steps and the procedures that you have to follow in order for you to be able to get your German recognition at the end of the day? Guys, it's quite self-explanatory. There is no much way that's better or less to say it. Just take it as it is, because it's a step, it's a method, so follow the methodology. Okay, you guys, so number one, on your side, which are the documents that you need to have on your side before you even go any further? Number one, you need your nursing transcript, you need your nursing diploma, you need your O-level certificate, your A-level certificate, you need your birth certificate. I understand there are now long and short birth certificates, but if you are coming from Zimbabwe like me, I would suggest that you produce a long birth certificate, and the one that's not filled in per hand, but the one that's printed in. I hope I'm making sense. Okay, and then you also need your national passport, your national ID, your CV. Those are the documents that we need to have. You need to have those documents before we go any further. And what happens to those documents? You need to photocopy each document, and each document has to be translated into German language. So your national ID, your birth certificates, those things cannot be translated because it's original as it is. But those academic certificates like your nursing transcript, your nursing diploma, your A-levels, those things need to be translated. You photocopy one O-level certificate, it needs to be accompanied by another copy that is translated in German language. We'll get into it in a moment. So say you don't have an A-level certificate. Is that an issue? No, it's not an issue, because guys, mind you, there was no way possible for you to be admitted into a nursing training center without an O-level, English and maths included. At least from Zimbabwe, that's what they do. So do not worry if you don't have your A-level certificates. O-level certificate works perfectly fine. Which board of examination? ZIMSEC, Cambridge, does it matter? No, it does not matter. Just produce your O-level certificate. Okay. Okay, you guys, so having said that, you need to photocopy it, and each copy has to be translated into German language. But your ID and your birth certificate, you can just give it as it is in English. Okay, so that is your part. What about the German part? The German part is for them to evaluate your level of education you have versus their level of education this side. All together, they'll look at your O-levels. Okay, O-level, they'll get it and say, according to German standard, O-level certificates is gauged like this. Say maybe Abitur, they call it Abitur, or they call it Gymnasium for their high school. They say, okay, according to German standard, you don't have Abitur, but you have Gymnasium. Don't worry much about what it means, but that's how they'll be gauging you. Okay, O-level or A-level. Abitur is level of A-level, Gymnasium is O-level. Okay, and then they'll take your transcript. On your transcript, it shows how many hours you took from the time of getting into class. What is anatomy? Remember that first lesson? Yes, up until the day you close to say, I'm going to go for my state final. They look at the number of hours you took for your theory, they'll look at the number of hours you took for your practicals, and then they will evaluate it against a proper or a normal nurse training program in Germany. They'll say, okay, for theory, these ones have got 8,300 hours. For our theory, normally we have 9,000 hours. So does it mean that you have to immediately have gap to fill in? No, they'll check in their 8,300 hours they did maybe the nervous system for so long. They'll look if it's necessary for you to fill in a specific gap. For example, on my side, I had to do the gastrointestinal tract. Once again, I had to do the nervous system. I had to revisit some few topics of psychiatry. Not because you don't know it, but because according to their gauging, you guys, according to their evaluation and according to the name of the country where you come from, or maybe it's South Africa or Namibia, they'll say for these ones maybe they have to redo the reproductive system. For these ones maybe they have to do the skin. You know, that kind of thing. So how long, you guys, after having submitted your documents to the recognition office in Germany, how long are you supposed to wait before you get your answer as to what you are supposed to do next as your next step? It varies. I had to wait for 6 months, depending on the country where you come from, depending on the things that you did during your nurse training. It may depend how long you have to wait, and depending on when you submitted your papers. Some submitted their papers before you, so you have to wait until they finish record or evaluating other people who were in the waiting list before you come. Such things have to be taken into consideration. So don't freak out when you maybe see 4 months have gone by and you do not have your information. And mind you, you are always free to ask in between as to whether your paper has been submitted and when you can expect to get your feedback. You are free to ask department that is specifically there for people who speak English, because they know that there are many nationalities that have got interest in getting their nursing diplomas recognized. So definitely you are sorted out on that. So right now, because of COVID, even if you are on ground in Germany, you want to take your papers personally, that is not going to be a possible option because of COVID. So usually the papers these days, because of our situation, everything we processed online. But believe me, they do process them. Just stay in contact with them, write them an email, ask them, and then they know. So if you are on ground, you are in Germany, you want to get your papers recognized, you want to get them translated, you can look for a translator, a verified and a certified translator will translate it for you. I remember I had to pay an amount of around 150 euros to get my papers translated before sending them out to the recognition office. Ask them per email as to how you can get your papers out there. Okay? Is there any better way to say it, you guys? I don't know. I think if information is out there, you may choose to take it or to leave it, right? One copy in English, another copy translated in Deutsch. Okay? Those two things, they go together. Do not by any means transport your original diploma or whatsoever. No, please guys, do not do that. Okay? All right. Evaluated you. So what next? Tell you which areas to cover. Now you have two options. The first option, they will say it's either you revise your notes as if you are going for a state final for 1 month, revise at home, and then if you are ready for a test, come and get into the exam room and do your test in writing. Or the second option is for you to undertake what we say is an integrated course for migrated nurses, recognition course. It will depend on what you have to cover, the amount of time that you need to spend doing that course. For myself, it took me 6 months again. So you may be in a position whereby you're in a class of 7 people. someone has got a period of 6 months to cover their practicals and theories before they go to their final examination. Someone has got the whole year. That discrepancy, someone may need more hours for them to fill in the gap as compared to you. Books, guys, that you need, for example, this book here, it's like a dictionary to be telling you the things that you need to look out for. Like if you did your nursing in English, don't worry, things will be sounding the same. Okay, don't worry, things will sound the same. For example, thrombocytopenia, that's what we used to say, right, in English. Thrombocytopenia. This side they'll say it's thrombocytopenia. Don't freak out, you get used to it as much as you hear it, and in order for you to learn how to say some things, I would advise you to partake in the second option of doing the recognition course instead of the one of revising for 1 month and jumping into the ideal for you maybe to have level B1 or B2. But you know what happens when you get into that course? They'll take you by hand and they'll push you into doing B1 and B2. Okay, so you may have your A1 certificate. It does not put you at a disadvantage of getting recognized. It does not. Just go and do your recognition course. If they give you that option, take it and then you'll be taught. But I also suggest that do not depend only on the recognition classes for the Deutsch course. Just register yourself extra so that you can have to go to school and learn intensely. I really took my German language seriously. Hence, you guys, it's going to be possible for you if you take your German language seriously. Don't blow it out of proportion. Yes, it's not your mother tongue, it's not your mama language, but you say you want to get recognized in the nursing field. There is no ways to go about it. You need to communicate with the doctor, you need to communicate with the patients, you need to give the report, you need to take reports. The nursing is all about communication. Yeah. I've said it. And then what are the things to expect in the examination? So you have undertaken that recognition class. Now it's your time for the examination. There is the oral part of it. Maybe say they'll give you a diabetic, like a scenario with a diabetic patient. Then you have to state the nursing problems that you see for that patient, the nursing goals and your implementations, your interventions. The nursing process, actually, they love it so much. And then the theory is done there. Okay, the practicals, there is the doctor's round. You will do maybe 1 or 2 patients with the doctor, say the history of the patient. You know how it is. I had to redo my fourth in Deutsch. I had to do my drug administration. I had to do my dressing assessment and everything, because they take them seriously. They put them here on top, and then other things may fall. So, okay, you guys, that is basically the recognition course in a nutshell. It's all about you getting your papers done, contacting the rightful office, and wait, okay, find out more information. If they say maybe you can post your papers like that in English, we'll get a translator for you. Find out how much it may cost you in a nutshell for you to get your papers, because you may not have to translate your papers. They'd rather have a translator here that's based in Germany. So find out, in case you don't have those resources for someone to get your papers translated for you, find out if they can do it for you, because I know in some instances they take it as a package and then they charge you at the end of the day. Passed your practicals. What next? Congratulations! What is left for you is to go to the Nurses Council or the Health Ministry, and they'll set an appointment for you. You go and pay a certain amount for you to have your diploma produced and signed, and then they'll tell you when to come and pick up your diploma. It's called an Urkunde. And what is your designation? In Zimbabwe, we say registered general nurse, but in Germany earlier it was called Krankenschwester. The name has not died out, but according to the Ministry of Health, it's called Gesundheits- und Krankenpflegerin. if you are a woman. If you are a man, it's called Gesundheit und Krankenpflege. So you guys, basically that's that. But now that you are a nurse, what next? I say stay tuned. Next time we're getting more into the details, and if you guys feel like you did not get much of the information where to do the German language lessons, just leave comments down below and I will get back to you. And you guys, do not forget to subscribe. Subscription is totally for free. That way we can grow this channel together. And guys, for those who sent me emails and I was late with my responses, I'm sorry about the late responses. I was having night duties back to back, and so the time to get back to the emails was kind of just tiny. But now, all things being equal, I'll get back to you. Pinky promise. Okay guys, until next time, ciao.